Speech off.
My name is Skylar. I am completely blind. I am autistic and I have a chronic heart condition. I have a tip for both patients and nurses. This should help everybody out. I kind of discovered it myself. You know, like if you're preparing for, if you're a patient, for example, and you're preparing for a procedure that might be a little uncomfortable and or painful, like getting a needle put in you or something, or if you're a doctor or nurse and you're preparing to do this to a patient, they might tell you to take a deep breath. But I really hate being told that as far as to relax, to like take a deep breath. So here are some things, some other alternative ways that medical staff, you can get your patients to relax. And patients, you can also follow these tips too. Some of the sounds that we make when we speak change our breathing, and they cause our exhalations to be slower, longer, and more gentle. For example, the S consonant, like if you do that, your exhalation is going to be slower, longer, or more gentle. Same with the SH. If you say shh, it relaxes your body as well. Which I made a video about shush breathing, so I'll put that in the description. You can click the link in the description. So if like you're a medical staff and you're about to stick a patient and you tell them to make the shush sound or the sis sound right before you stick them, it will work, because when you make that sound, the sh or s, what happens is what you're doing is you're slowing your exhalation. You're making your exhalation longer, slower, and more gentle. This is what's going to relax your body if you're the patient. So like if you're about to stick a patient and like right before you tell them to go shh, or you tell them to say s, it will relax their muscles. And it should be a little bit better for both of you. Last year when I went to go and get my flu shot, well, I always have my mom say one of my favorite words right when I'm about to get stuck. But I noticed that I was like really tense before he even touched me. And so what I did is I said the word hex. This works because certain, number one, hex is one of my favorite words, but number two, some of the speech sounds within those words, within the word hex, slow your exhalation and make your exhalation more gentle. Again, with the slowing of the exhalation. Certain sounds that we make our exhalations longer or slower. Now, for like kids patients, you know, you could ask them, you know, if they're young and they don't understand all that, you know, just ask them, hey, do you know what sound the letter S makes? And when they say it, that's when you stick them. So, yeah. Or you can tell them to whisper, because when you whisper, it also makes your exhalation longer, slower, and more gentle. And like you can ask them to whisper a word that, for example, has a lot of S consonant sounds in them, because remember what we just said, the S consonant slows your exhalation as well. So for example, when you're fixing to stick them, tell them to whisper sassafras or something, and it should help them because of the slowing of the exhalation. Also, something that the patient can do or should do, sometimes when I go to get blood drawn, I always bring something that I like the smell of, like my catnip spray, and I spray it on my face mask. So when I breathe in through my nose, I can smell it. And I don't know if you know this, but like woodsy smells and like catnip and other woodsy aromas relax me. So if you're a patient, just bring something with you, that you like the smell of, and just put it on your mask. Yeah, it should help. So hopefully you enjoyed this video, and God bless.